At Professional Risk Management Services, our medical liability insurance program for psychiatrists and behavioral health group practices, the Psychiatrist Program, is designed to meet your needs throughout the various stages of your career. As a national psychiatry-specific program, a policy with PRMS can cover child and adolescent, forensic, early career, and military psychiatrists, as well as moonlighting residents and fellows, part-time practitioners, and telepsychiatrists. Learn more about how PRMS can protect you.
Good evening, everyone. My name is Dr. McDaniel. I'm here with Dr. Mohyddin, and tonight is this episode of WPS podcast. Before we begin, I'd like to introduce Dr. Mohyddin. Dr. Mohyddin, before starting his career in psychiatry, Dr. Mohyddin was in neurosurgery. But instead of fixing brains, he became fascinated with understanding the intricacies of the mind and the emotions that they house. That curiosity obviously led him to us here in psychiatry, where he spent his career not just treating patients, but transforming the way we teach, the way we practice, and the way we experience therapy. Today, Dr. Mohyddin serves as the chair of psychiatry, training, and education at St. Elizabeth Hospital. He also leads the psychiatry residency training program, and he teaches in the forensic fellowship program. She's a faculty member at George Washington University, as well as an outpatient psychiatrist at Georgetown University. His leadership, of course, extends beyond academia. He's played key roles in national psychiatric organizations and even chaired the administration and leadership committee for the Group for Advancement of Psychiatry. He's worn more hats in psychiatry than most people do in a lifetime: program director, group therapy extraordinaire, and existential explorer. He's trained the next generation of psychiatrists. He's chaired national organizations, and no big deal, he's also picked to be the psychiatrist of the year at some point. I'm sure if there were a Hall of Fame for teaching and leadership in psychiatry, he'd already have the Lifetime Achievement Award in that. But here's what makes him stand out. He doesn't just practice psychiatry, he brings it to life, whether it's through group dynamics, existential psychotherapy, bibliotherapy, or even music. He believes healing isn't just about medication or diagnosis, but it's about connection, meaning, and sometimes finding the right poem for the right moment. I introduce you all to Dr. Mohyddin.
Thank you very much for that kind introduction, Dr. McDaniel. Just a small correction. I used to be a Georgetown outpatient, no longer, but I'm still an outpatient psychiatry, do a small private practice. But other than that, it's been a journey. So thank you for your kind words.
Absolutely. And my name is Dr. Charles McDaniel. I am a PGY2 at Howard University Hospital, and I'll be conducting this interview with Dr. Mohyddin. So let's just jump right into it. Dr. Mohyddin, you had a fascinating journey. You started in neurosurgery, which a lot of people aren't aware of, back in Pakistan. And now you've come here to psychiatry in the US. Take us back to that transition. Tell us a little bit about it and ultimately what inspired the shift.
Well, it has been a very interesting journey, and it's something that I don't talk about much. So thank you for giving me the opportunity. It is, as my first analytic supervisor said, Dr. Edward Kushner, he found out that I was a neurosurgeon and now I'm becoming a psychiatrist. And he said, always trying to get into that brain, one way or the other. So that has been the journey. That has been the journey. I can tell you that part of my, I think, is kind of going for whatever is the biggest challenge that I can find. So that has been part of the thing that has been defining my life. And when I graduated medical school, neurosurgery was considered one of the toughest fields because particularly the field of skull-based surgery. So I did a skull-based surgery fellowship at GW. I did a neurosurgery, general surgery, then followed by the neurosurgery training in Pakistan. And one of the things that happened as part of that journey was that I realized after doing several years of training that even though technically I was very happy, I was working in a large trauma center, you're saving lives every day with patients with head injury. But the satisfaction of connecting with patients, my patients came in unconscious and left unconscious. And then came an opportunity. I moved to United States with my family, I migrated here, and it gave me an opportunity to start over again. And that's the time when I was doing some soul searching about is this what I want to do for the rest of my life? Because the satisfaction I had envisaged when I was in medical school of having the patients and the relationships was simply not there in neurosurgery. I mean, it's a wonderful field. I love and many of my friends are very good neurosurgeons, but I like the relationship aspect of it. One of the things that gave me a clue for uh, that I could be a psychiatrist was that during my neurosurgery days, if anybody wanted to give their patient's family bad news, they would look around and where is Farooq and get him so he can talk to the patient's family. He'll give them the bad news. Nobody else can do that. So I knew that I could talk to patients. And at that time, when I migrated here, one of my friends who was a wonderful psychiatrist at St. Elizabeth's Hospital said to me, if you're thinking about it, why don't you think about psychiatry?
Mm-hmm.
It's an interesting transition because I never thought about that in the past. And, it's not like something I've dreamt as a child, but here I am. So I'm restarting. And I did some volunteer work
Yeah.
at St. Elizabeth's. And that really opened my eyes to this is the thing that I love. This is the thing that I want to do for the rest of my life. So it was a interesting time. It's also one of the things because I know this series that I want to thank Dr. Swardi, the NWPS leadership for starting,
Mm-hmm.
is about talking to the trainees about future careers and career leadership and mentorship. And one of the things is to never be afraid of switching course. My friend said you have put in years of work in neurosurgery. I've used to do 50-hour shifts, alternate night on call for years, and you've put all of this work in, and now you're gonna change course and do something else. And actually, it has been the most rewarding change. And I would never. This is one decision that I've always loved. So for trainees to know that sometimes it's okay to change course as well.
Oh yeah, that's absolutely awesome, man. That was something I was thinking as well while you were talking. Like to switch from neurosurgery is such a long training that you had to go through, and then to start over, you had absolutely had to have a level of passion. I think that passion has actually been exhibited by you just by reading your resume. You've had a myriad of leadership roles in psychiatric education and training. I'm wondering now, with all your experience, what do you think are some of the biggest gaps in psychiatric training today, and how can we as up and coming residents and people in the field address them?
I think that there are, this being a program director, there is always a wish list.
Right.
So that's some of the things. But I think that all of the new research that is coming out in social determinants of mental health,
Mm-hmm.
I think we are not paying enough attention to that. There is a lot of focus on which pill, which neurobiological mechanism will do which treatment, but the bigger picture sometimes escape residency training programs. So I would say there's a lot of things that I wish that we would teach more in all residency training programs. In my own residency training program, I do implement many of these things. So thinking in terms of social determinants of mental health, existential issues. Nobody wants to talk about aging. This is so fascinating.
This is
I
true.
remember there was a conference that we were attending uh, yeah, about biases, and we talked about all kinds of bias, racial, gender, orientation, all kinds. Nobody talked about the bias about aging because even though we're all aging, nobody wants to. So things about existential issues, aging, but particularly the severe and persistent mental illness,
Mm-hmm.
because since all my career has been in public sector psychiatry, I've been always at St. Elizabeth's Hospital since I became a psychiatrist. I did my residency there. I've stayed there ever since. So it's
Mm-hmm.
been a journey in which the part of it is the mission for the public sector psychiatry for the most unfortunate who get a severe persistent mental illness, patients who will suffer, and to serve them is an honor. And that kind of an aspect that all residency training programs, many do, but not all, you know, emphasize as much the aspect of service.
Yeah, for sure. I mean, the social determinants of health is especially with the population we serve is crucial to be able to understand that. So I totally understand your point in that. I mean, it's something that helps with patient care, even patient advocacy. It makes all the difference, in my opinion, at least. So I have another question and pertaining to that. I know you've trained many future psychiatrists, so I'm wondering what qualities do you think are crucial as psychiatric residents? What do you think is crucial for us to develop in terms of our clinical knowledge and even beyond that'll ultimately make us more well-rounded physicians?
I think one of the most important qualities when even when we're looking for residents, hiring people, is, medical knowledge, interest in medical knowledge, clinical knowledge is imperative. You have to be a good psychiatrist. You have to have a good knowledge base. But in addition to that, just being interested in human condition, interest in sitting with another human being and really understanding what's going on with them.
Hmm.
Because the clinical knowledge only goes so far. Then the empathy, then that what you develop as a relationship is one of the most important quality of a psychiatrist. So broad interest in human condition, curiosity about another human being, and most importantly, humility, knowing that we don't know everything. Our patients teach us a lot. So
For
these
sure.
are things that are really significant and qualities that I would look for in a good psychiatrist.
Absolutely. I think that brings me to something a friend said to me. He asked me, "Oh, Charlie, since you become a psychiatrist, do you sit in a room now and analyze all your friends when we're talking?" And I said, "I think actually since stepping into psychiatric residency, I've learned more about myself than other people. I've become more introspective than I have become more investigative." But that just reminded me of that. Not to step aside, but so I
But
know
I think
that
Dr.
before.
McDaniel, that says something that, if I may interrupt for a minute,
Yeah, for
I think
sure.
that's a great thing that you bring up. I think if somebody comes into psychiatry residency and leaves the same person that they came in, we
Mhm.
didn't do our job very well. We want to make them more introspective. We want to make them more. That's a great thing that to hear talk about.
For sure. So I know me and you. Well, everyone doesn't know, but me and you know we had the opportunity to speak before this podcast, and we shared a great conversation, some great conversations. But one of the things that stuck out to me was our discussion on future career goals and shaping them, and how important that was to do during residency. You stressed the importance of letting your imagination run free.
Mhm.
So since the people here weren't privy to that interview, can you share some of that insight and what you meant by that?
I'd be happy to talk about it. I know some of the people who are attending, and many of them are my mentors, so they would know this already.
Oh
They're
yeah, for
people that
sure.
I learn from. But I think one of the advice that I got when I was graduating residency training program was from my residency training director, Dr. Joseph. Wonderful guy. I asked him, how do I go about looking for a job? And he said, try to let your imagination, imagine what kind of job will make you happy
Hmm.
and try to get, and let's see what happens. So I told him I wanted to be doing some clinical work as well as education. These are two of my passions. I want to see patient, but I also want to do education. That's my goal. And exactly that's what happened within months. There was a job. He hired me. Actually, he hired me himself for a job of a right out of residency for the director of medical student education. And I found a part-time job at Georgetown doing outpatient work, seeing patients. So that combination, so that is one of the things that I encourage. I want graduates to think about what would make them happy. And
Hmm.
really, this is an opportunity when you graduate to create not just, oh, this job will pay more, a little more than that, but more importantly, where do I want to be 10 years from now? When I look back at my career 20 years from now, 30 years from now, will I be satisfied with what I have done in life? And that's the kind of thing that I encourage people to think about. That's how I want people to think about career. At the end of your life, what will you look back at the end of your career, and how satisfying will that?
Wow, that's great advice. You gave it to me before, and now you give it to them as well. But I just, even to hear it again, makes me think of the importance of thinking about the future and the kind of the legacy I want to lead and how important that is. And I'm sure the residents here, they've been jotting down this info, thinking of ways they can implement these things into their journey. But let's switch gears a little bit. Let's focus on some of the work you're doing in psychiatry, particularly in group therapy. Group that just by reading about you and talk and thinking about you, group therapy seems to be the cornerstone of your work. What drew you particularly to this modality, and how does it shape your understanding of human connection?
So I started actually learning about group therapy uh, long before even I was in psychiatry. I think I started learning about groups when I was born, because you're always born in groups and you're always in groups for the rest of your life. So the dynamics are always there. But even before I started my psychiatry training, when I was volunteering at St. Elizabeth's Hospital, there was a wonderful psychiatrist, Ken Gorelick, who was
Mhm.
at that time teaching a course. Some of the people here present may know him, senior analyst, wonderful guy, Ken Gorelick. He was doing a course on bibliotherapy, which is basically utilizing poetry and other creative things, in group therapy settings.
Mhm.
I started learning about group therapy even before uh, I started learning about psychiatry. And that showed me the power. Anne Alonso, who was an amazing group therapist, said in individual therapy, patients will describe your problems to you. I'm paraphrasing a little because her exact quote, but she said in individual therapy, patients will describe their problem to you. But in group therapy, they will have the problem with you in the group.
Wow.
And that is the best place to resolve it. And I found groups extremely powerful. And that's where my interest in groups developed. And I continue to teach, practice groups, a lot of interest in group therapy as a powerful healing modality. I'm particularly interested in education, in medications, but this is another very important area, which I do believe that is not being taught enough in residency training programs for
I agree.
psychiatrists to be able to do groups when they graduate, when we're leaving aside a very powerful tool.
For sure. And I definitely agree. I think even as you just described in the beginning, group therapy seems like an opportunity to foster an even deeper connection with your patients. And from my little time in group therapy, I've seen that group therapy often brings up these deep projections and transference and counter transference. Do you have any particular memorable moments in group work where you saw a breakthrough happen in an unexpected way?
Well, it's a. Let me give you an example of because a training group. This is not a patient group, so I can talk about it. It's a training group. So I
For
was a
sure.
member of this training group led by this wonderful group therapist here in DC, Macario Geraldo, amazing guy,
Hmm.
leader in Lacanian analysis. He was doing a group with a training group, and in the training group, one of the members was struggling a lot with his deceased father's directions. He couldn't get over that,
Hmm.
and the transference was such to the leader that he kept looking to the leader and would still get stuck. It was a 2 day group. So, and Macario turns to the person and says to him, "Stop it." And instantly this person transforms in the group in front. So I mean, I've never seen something so. It's a wonderful thing to see the power, the group where he was able to be vulnerable in a 2 day
Hmm.
group, and it's like, and he said nobody had ever said that to me. And for the rest of the group, the guy did amazing work. He was able to go back into why he was stuck with his father, etc. So these are the kind of examples that you see. This is a transferential example. Is obviously he didn't cure the person, but you
For sure.
see an example right there that the person understood something in a 2 day group that he hadn't understood probably lot of therapy before that.
Absolutely. As you talked about earlier, you said a lot of your work has intersected with bibliotherapy and the use of creative expression and healing. How did you first discover this therapeutic power with bibliotherapy? And do you have any particular connection to literature and poetry?
Well, not a particular. I just like to read literature and poetry, so it is one of the things that is one fascinating. Again, psychiatry is so huge. I talk to the residents many times about how many different ways people can practice psychiatry.
Hmm.
And most people are not even aware of bibliotherapy. It's not even practiced much these days. But one of the things that is that it is a lot of space of combining creative art with healing. And these are very powerful modalities that we can bring. I remember for me, what was very impressive was that I used to work in those days in some chronic, very sick patients who had been inpatient hospitalized for decades,
Hmm.
and we got together and I asked the group together to write a poem, and each person contributed one line of the poem. It was
Hmm.
one of the most beautiful things that I had seen. These people who we are kind of forgetting, the society is forgetting this warehousing in some ways and chronic units. These are never going to get better or something. But they wrote this wonderful creative poem and they were so proud of it. We actually published it. I unfortunately don't have a copy of it. It was published for 25, 30 years ago, a long time ago. So I don't have a copy. But to see the power, it's always there. And creative arts to come, we have at St. Elizabeth, I'm working at St. Elizabeth, and we have wonderful creative art department that do great work with our patients. It's beautiful to see, patients who are totally non-responsive, and suddenly the dance therapist puts the music on, and everybody gets up and starts dancing. People who are not communicating communicate through music, through dance, other ways.
For sure. I even in terms of poetry, particularly, there's rhythm, there's repetition, there's an element of storytelling. I think I haven't had the chance to do this with you, but I can only imagine how poetry would in that way give people an opportunity to externalize their emotions that they may not have been able to do in some other way. Um,
Yeah, I think poetry, in some ways, poets have, wonderful poets have this capacity to say things
mhm,
that are present in our unconscious, but are blocked by our conscious in so many. They connect with people in so many different ways, and that is a huge contribution.
sure, absolutely. And I know you speak extensively and you presented as well extensively on existential issues and group psychotherapy, as we talked about. Nobody wants to talk about aging, as you mentioned earlier. So, is there anything that drew you to that specifically as well, existential psychotherapy, and how do you incorporate that in your clinical work today?
Well, I think my parents used to say that I was an old soul when I was born. So people wouldn't think about meaning of life, but from very young age, I think I have been thinking about meaning of life
Hmm.
and how does one make meaning out of life. And that has been a journey. When I started learning about existential psychiatry, I said, this is the field that, really helps me understand, because we all have to create meaning for ourselves.
Sure.
So from a very early age, I have always thought of creating what will give me meaning. So this is, such a joy to be doing this work, to be passionate about education and to have a career teaching, to be passionate about seeing patients and connection and establishing connection with patients in the same way, service. So from very early on in life, I decided that what gave meaning to my life was service. So in addition to doing the teaching and the clinical work, there is service that, I'm a member of Washington Psychiatric Society. I've tried my best to serve people and our patients in the capacity we can. So the service becomes a cornerstone of how
Hmm.
do we find purpose and meaning in life. So to me, existential psychiatry is constantly learning about myself and what gives meaning to my life, and then hopefully teaching it to others, to residents, to trainees, to patients, to everybody that I communicate with.
Absolutely. I think in thinking about that and aging, we sort of kind of question once we start to question our own permanence, that's when we start to define purpose and wonder why we're here and what we can do to make a lasting effect. What are people going to think about us once we're gone?
Mhm.
So I think that that's very interesting. I look forward to being able to learn some more about that with you as well. And doing some research on you, I came across a boatload of workshops you've held. One of them had a very interesting title. It was called Don't Push the River, It Flows by Itself. Can you share with us that philosophy behind this and how it applies to psychotherapy, in your opinion?
It is the title that I believe in. Don't push the river; it flows by itself. You
Yeah.
have would see how many people we see every day in
Hmm.
our circles, in our friends, in other people, in our patients who are trying to push the river when
Hmm.
they don't need to. I think that is one of the reasons that I wanted to do this title, because it's so common and yet we keep doing it. We
For
see it
sure.
in so many people around us. And I think that once we put words to it, I think that's hope is that the people and our patients and people that we work with will start paying more attention in therapy or in other modalities, will start paying attention to what they are doing.
Absolutely. So, and that brings me to my next question. I know you spoke about, at least in your work, some of your workshops that I noticed, I know you spoke about the importance of maintaining authentic connections across all the mediums we have. So in today's world, especially with social media and the rapid digital communication, I know it's so easy to get used to these microwave connections we have with each other, just quick fix, pictures, a couple words. Now I know everything about you. So in your opinion, as a psychiatrist, how do we cultivate more genuine, more meaningful connections, both with our patients as well as each other?
I think that's a very important question. That's a very interesting question. And I think sociologists will be answering that for a long time, because, on one hand, it's easy enough to say that the digital is not as good as meeting. When your Facebook friends will never give you the joy that a real friend gives you when you get coffee with them or sit at dinner with them or just talk to them.
Hmm.
But on the other hand, this is the world we live in. So I think psychiatry in some ways is lagging behind because the world is going far beyond. I mean, now we think about AI and everything else. We
Hmm.
need to be able to see that the new word that is going to be there. We have children who, before they can speak, can operate iPhones and stuff like that.
Yeah.
So this generation is going to grow up digital. And to for us is to work to create the same connections no matter what kind of communication devices and other things we are using. Now, will it replace the same thing? I don't think for people my age. I think our generation, we like the connection in person, and that is a very different feeling. And I think human beings are going to be very differently communicating over the next generation or so because of the rapid evolution of all of these digital technologies. Will they replace the joy of seeing somebody in person? I'm not sure,
Yeah.
but I think we still have to figure out authentic connections. It was interesting. I think it was Oxford Dictionary who said that the 20, oh, sorry, Merriam-Webster's who said that the 2023, the most searched word in the entire world was
Hmm.
authentic. Everybody in the world was searching for the word authentic. So this is the most searched word of the 2023 year,
Hmm.
according to Merriam-Webster Dictionary. We are all looking for connection. Yet we are all thinking that sending somebody a text or liking somebody's post is going to make up for that authentic connection. I
Hmm.
don't think that that makes up for it. So that working and helping our patients and learn how to establish authentic connections, that's one of the things that's why I like group therapy. And group therapy can be done virtually as well. Many people just do virtual groups, but you have to work on establishing authentic connections where we feel that the other person really understands us, is hearing us, and we are hearing them and communicating them, and to be able to be present emotionally with each other. One of the things that existential psychiatry emphasizes is presence or being. And
Hmm.
being is a very particular term when used in existential psychiatry, when you know that you are there for the other person and they know it, and they are present for you and you know it. So I
Hmm.
think that's where the existential psychiatry and group all come together for me, where we can demonstrate that in the moment of being present.
For sure. Yeah. And that even while you were talking, it made me think about, I know where a lot of practices at least are shifting to a model where there's a lot of like WebEx therapy or therapy over Zoom. And I'm just wondering, will that the connection that we've been able to foster in group therapy in person and inpatient in person, will we start to lose that as we become more inclined to work online? But I know that the opportunity that online provides is to give us patient care for people who can't come out the home, etc. So I think there's pros and cons to it all. I think it'll be interesting to see what it looks like over the next couple of years.
I think it provides us with opportunities that we may not have present otherwise. So I've
Hmm.
always done this aging group kind of dealing with the existential issues towards end of life group. One of the major problems in that group had been in the past that people would get sick as they get older and they would end up in nursing homes and they could not join. So now with a virtual group, wherever they end up, they
Yes.
will be able to attend a group if they are really connected in an existential issues group where they're dealing with life and death, that they
Hmm.
will have the support. So the opportunities that it presents, we also need to appreciate. I think that there is a lot that's going to come soon. One of the major areas that psychiatry programs have not yet really focused on is AI,
Hmm.
AI in psychiatry. And it will provide opportunities. It's like, we can't go back and say we don't need the internet anymore.
Right.
It's
It's
the
too late for
same way AI is coming, and we have to
that.
be as psychiatrists ready for what it is bringing because the field is outpacing what we are doing in residency training programs right now. So
Hmm.
we are emphasizing in our program to just start teaching residents about somewhat about what the AI is bringing, what are the different platforms, etc. Not to teach it as to use it, but to understand what is coming, what are the large language models, and how are they being used in the country right now.
Yeah, I can only eagerly anticipate what is to come in the future, especially as I look for career opportunities, etc. So we've got to talk a little bit about, your therapy interests and what brought you to them. And over the long span of your career and all the things you've done, I'm sure you've been able to recognize that a career in psychiatry, it requires a certain level of emotional resilience. And for someone who's had such a lengthy and promising career as yours, how do you maintain your own well-being while taking on such a demanding clinical teaching leadership roles? How do you handle it all?
I think that what helps a lot is what I started out at the beginning by talking about. If you are passionate about something, it doesn't feel like work. I get up in the morning, I'm excited to go to, I'm looking forward to what I'm going to do today. I'm
For sure.
excited. And at the end of the day, when I say, okay, now it's time to go home, it's been, looking back and say, oh, it's wonderful day. Each day, what we have accomplished, what we have done. So I
Mhm.
think that there should be an emphasis, and I think we teach that, we try to teach them. When I was trained, there was no duty hour limits in surgery. So there was a very different mindset.
Mhm.
But now we come from a very different mindset where we do emphasize well-being and we do talk about. But I think what helps a lot, being able to do a lot more, is if we can find our passion and we can do what we are passionate about, then it doesn't never feel like work. It just keeps on. We can't keep giving on more and more.
For sure, yeah. There's definitely an importance to passion. It'll keep you going when there's nothing left. As a resident, it's something I've come to become very comfortable and familiar with. I think that so far we've had a wonderful interview, Dr. Mohyddin. I'm wondering if my last question is true to theme in asking you this, and if your career were a poem, what would its theme be?
Oh, I would say that yeah, it's a good question. Um, Maybe finding meaning and purpose in life, that constantly striving to find meaning and purpose and defining that for yourself. That would be the focus of the poem if it was a poem like that. And there are many good ones like that, but
Yeah, absolutely. I think that we can all attest to that, finding a poem that I think poems even help us find that meaning generally. So, ones that we can connect with and ones that we can, find some sort of to operate in the context of. I think that would be cool. So I'll end our interview so far with by saying this: some psychiatrists, they analyze symptoms, but Dr. Mohyuddin, he's on a mission to make therapy more than just conversation. He's here to make it dynamic, a transformative experience, if you will. It's been a pleasure asking you these questions, Dr. Mohyuddin. I appreciate you giving us your time as well as your information. Now we're going to open up the chat for any questions that anyone may have.
well, thank you. Before anybody asks questions, thank you, Dr. McDaniel. That it's been a pleasure talking to you.
Absolutely, it's been a pleasure. You've trained hundreds of psychiatrists as well as colleagues in the field. What would you like your legacy to be?
So I think that in the beginning, when I started doing this work and teaching, there was always this thought that this work will be my legacy. Until I did become read more about existential psychiatry, and then I found out that everybody forgets your name in 75 years. In three generations, nobody remembers you. What I
Mhm.
would like my legacy to be is to, just get people to do about the best they can do wherever they can, the service they can provide, what will they like to do in the moment. That is the most important thing. Not thinking about how people will remember. People will not remember me 100 years from now. But what will be more important is what I have done now today, being with you, being with everybody else here, and what good can I do today?
Someone asks, with the emphasis on cultural humility you mentioned, what differences do you see in U.S. medicine from Pakistani medicine?
I think that I've been very fortunate to be trained here in the United States in psychiatry, because I don't think that psychiatry is as well developed in Pakistan. So there's a lot of emphasis on treating severe mental illness, but this emphasis on actually understanding human beings that we learned here, that I have learned here, as part of being the cultural humility piece, that everybody has to be come in with cultural humility, not knowing. For me, actually, it's been an advantage because I come from a different culture. I came from a different culture. Now I'm a United I'm an American, so but I came from a different culture, so I could be very curious to anybody. I could ask a question. I don't understand. What does it mean? I'm not from this culture, so I could learn a lot easier. And I would encourage everybody to come in with that cultural humility because it helps her understand patients a lot more. I know Dr. Dunlap has her hand up.
So,
Mhm.
Dr. Moyen, this has been, and Dr. McDaniel, this has been a really nice interview. And one thing I like about these podcasts is that it's an opportunity to get to know our colleagues more, just having this time. And so I have a question, but let me just set it up. As you know, I came over and did a third year continuing case conference when you were in training. And Dr. Joseph invited me to come over, and I would comment to Dr. Joseph each year. I would say, "You have the most remarkable trainees. What is your secret?" I mean, the trainees were just impressive and from different parts of the world. And so I'm not surprised. Farooq, to see you in your position, just to see how you have grown. So one thing that I just wanted to mention is that, sometimes people think that trainees go to St. Elizabeth's like as a last resort. They don't know about the Dr. Prudhomes. They don't know about the Gerald Posts, the Catherine May, um, Frances Cress Welsing. And so what I want to ask you is, what do you think really, what are the qualities that do cause international medical graduates to be such strong trainees? And what do you think that people, um, training programs should know as they consider IMGs? What are the strengths that you think IMGs bring to psychiatry?
I think that this is a great question because myself being an IMG and being in this position today, one of the biggest thing is that being in United States where there is a level playing field in terms of coming in from outside and being able to serve, but also being able to get great training and to take on leadership roles in the country. The opportunity is there, which draws a lot of brilliant people from around the world to United States. The training is excellent, the opportunities are excellent, so it draws a lot of brilliant people. And then we have to keep in mind that when we are selecting people for residency trainings as a program directors, that we have to get to the place where we pick the best person that will serve the patients best rather than where they are from. So when we look at that, we don't look at IMG or US senior or anything. We look at the best person possible. And since we draw a lot of cream of the crop from around the world, it gives us an opportunity, a very wonderful selection pool. So that is, I think, one of the things. I hope I answered your question, Dr. Dunlap.
Yes, yes. Thank you.
So we have another question from Dr. Patterson. He said, your enthusiasm and excitement is wonderful as always. How would you encourage our younger colleagues to maintain their excitement and enthusiasm in these difficult times when reality is variable depending on who's speaking?
Again, it's one of the challenges. That's a great question because it is the challenge, isn't it? How do we maintain with what's going on? And I think every day, even now, we hear people very upset with sometimes some of the things that are going on, and then how do we get them to maintain their passion? So one of the things that we talk as an existential psychiatrist, we talk about living in the present. We don't live in the future that bad things are coming in the future. We don't live in the fear of the future. We'll try to live in the present the best we can. So if for me this is the best use of my time that I'm talking to you, Dr. McDaniel, at this hour, then this is the most satisfying thing. Being able to live and be present in the moment is the best antidote to any kind of despair. Because if we can do it to the best of our ability, then we know that at the end of the day that we have done what we needed to do.
That's phenomenal. I have a mentor one time that told me that anxiety was a waste of imagination. It's better to kind of live in the present than to operate either in the past or the future. So I agree with that sentiment. I think we have one other question, and it says, how do you see technology, specifically AI or telepsychiatry, shaping the future of psychiatry?
I think it's going to be to me, I don't know, I'm not a technology guy, but for me, I think it might be revolutionary. I just heard the prediction that in 2 years, when we're interviewing people virtually for residency training, we will not be able to tell if it's a real person or it's a computer generated. That there would be no way to. So I think that the world is changing very rapidly.
Mm-hmm.
Are we going to go back to interviewing in person? I mean, this is going to be a sea change. People's avatars will interact with each other online, and what does that mean? So all of that is, and then on the other hand, AI is going to bring a lot of efficiency to our
Yeah.
work. I do believe that it's going to make us much better. All the mundane tasks that psychiatrists hate doing will be taken over by AI. Some simple things, simple repetitive tasks will go away for human beings. So there
Nope.
will be a hopefully. I tell you, I asked Chat GPT-4 to give me a psychiatry residency training curriculum, and in 2 minutes, it gave me an amazing curriculum for all 4 years of training.
That's incredible. Dr. Dietrich says that your last statement sounds very Buddhist.
I think we learn from where we can.
It doesn't look like there's any more questions. But again, this was a wonderful opportunity, Dr. Mohyddin. I really appreciate your time, not only today, but in other days that we had the opportunity to speak. I thought it was wonderful to learn from you as well as take some of your perspective. I can't wait to integrate it into my own practice and learning experience moving forward.
Thank you for that. Thank you for being the interviewer. And it's been a fun thing and pleasure to see a lot of friends here that attended. Thank you, everyone.